We are extremely concerned about hospitalizations and hospital capacity. So that is also important to remember.
A big decision by one federal judge in Florida. More on what Dr. Dana Hawkinson has to say about that and the impact this could have on you and your family's summer vacation. Live now to Salina, Kansas this morning, thanks to our partners there at KSNW TV. Studies have now shown those living in rural areas are less likely to have health insurance, and they have to drive quite the distance to get medical care. Now there is a plan to help change that. It's called Kansas Center for Rural Health, and it's based in Salina. A look at how this new center is bridging the gap, coming up now on the Morning Medical Update. And good morning to you. Thank you so much for being with us. It is Tuesday, April 19th, and we are live on Facebook, YouTube, and Twitter at 8:25, a way to help the much-needed blood supply here locally and also assist Ukraine refugees at the same time. At 8:15, Dr. Nathan Bahr is with us today. He will join us with our COVID count. But first, our topic this morning, it's not like back in the day of doctor house calls, but at least now those living in rural areas won't have to travel as far for their health care needs. That is all thanks to the formation of the Kansas Center for Rural Health. Get your questions sent in to us on YouTube, Facebook, and the Medical News Network. You can find links to those right there on your screen. First, this morning, we're going to take a live look at KCI from our Scout camera. Today is the first full day you will not be required to wear a face mask in the airport or on planes. But just hours ago, a federal judge in Florida struck down the mask mandate for airplanes and other public transport methods. Delta, American, United, Southwest, and JetBlue now all say that face masks are optional on their airplanes. Dr. Dana Hawkinson, our medical director of infection prevention and control, says there are a lot of factors to consider if you plan to fly.
Do you want to risk that you are going to be ill or sick for this trip that you are going on? So there are many factors there, both individual and as a community, that we have to understand. And I think that moving forward, the way to go and the way to be the safest is to continue to do the masking.
Meanwhile, on the ground, Amtrak says it will no longer require face masks for passengers or employees. Last week, the CDC extended mask mandates through May 3rd. The Biden administration is reviewing that ruling. Finding a doctor in rural areas can be tough. According to the National Rural Healthcare Association, there are only 40 doctors per 100,000 people in rural areas compared to 54 doctors per 100,000 people in the metro. Add to that, those living in rural areas make about $10,000 less than most. And with 25% of children living in poverty, getting the medical care that they need to stay healthy can be beyond challenging for those folks. That's where the Kansas Center for Rural Health comes in. Based at the University of Kansas School of Medicine in Salina, the center works with doctors in smaller communities to improve access to health care as health experts work to overcome a number of factors, including treating chronic conditions. Joining us this morning to talk more about this new center is Dr. Akinlolu Ojo. I got that right, didn't I?
Yes, you did.
Oh, good. I'm so happy. Okay. He is the executive dean of the University of Kansas School of Medicine here on the campus here, and a professor of medicine and population health. Also, Dr. Robert Mosier. Hi, how are you today?
Good morning.
He is the Dean of School of Medicine in Salina. And rounding out our panel is Professor of Population Health, Karen Weiss, who is also incoming Director of Research for the Kansas Center for Rural Health. Good morning to you, Karen. How are you?
Great. Good morning to you.
Great. Thank you so much for joining us. We'll get to you in just a moment. But Dr. Ojo, let's start with you. How did the idea of this center and this need come about?
Thank you very much. The idea of the Kansas Center for Rural Health is simply a continuation and an intensification of the effort to improve the health of rural Kansans that has been ongoing at the KU School of Medicine and School of Nursing and Health Profession, as well as the UK health system for a long period of time. We wanted to use the center as a platform to look at all the aspects of rural health delivery as well as the supply of healthcare provider in rural Kansas. We think there are opportunities for improvement to help get the people of rural Kansas to a better state of health and deliver health care for management of both acute and chronic condition more optimally.
So, Dr. Weiss, I want to ask you about the center itself. There's going to be a virtual aspect of this, but there's also a center there on campus. Tell us a little bit about how the virtual aspect will work and what people can expect.
Well, I think that COVID has taught us a lot about maximizing our virtual capabilities. And so we want to partner with our rural critical access hospitals and the clinics. And we may be doing that virtually. We may be doing that in person. We're also going to leverage capabilities within the University of Kansas Medical Center. And that may be done virtually or that may be done in person.
So, Dr. Weiss, what are some of the biggest challenges that medical professionals have in reaching and working with patients in some of those smaller communities?
Well, there's a lot of challenges, and I'm a nurse, and I guess I could speak to it from a nursing standpoint. But there's resource issues. There's a tremendous shortage of nurses. The nursing workforce is being in a lot of the rural areas. It's being manned by traveling nurses at a huge expense. So I would say that resources is a big one. Sustainment, training, sustainment of training capabilities is important. That's another thing that we hope to help the rural communities with.
Dr. Mosier, I want to bring you in as well. So talk about your partnership here and tell us a little bit more about the center from your standpoint.
Yeah, thank you. Yeah, as you can see, we know that clinical services are really only going to address about 20% of the healthcare disparity in rural Kansas. And so this is going to take a multidisciplinary, multi-sector approach. And so we're very pleased, that the School of Nursing is a partner with us on our Salina campus. Dr. Karen Weiss being part of the faculty there, the Hartley Endowed Professor for Rural Health Research with the School of Nursing. So even the staffing of our center is going to have this multidisciplinary approach. And we know we need to work with a multitude of our rural partners across the state as well as within and across KUMC. And so we're working to develop a lot of those relationships. And we'll be focusing around research somewhat, but mostly a pragmatic approach. How do we take new evidence and put it into practice out in the rural setting? We'll be looking at what can we provide in the way of education to support our rural providers or rural health care systems. And then in some cases, maybe service will be part of that, but that may be related around how do we keep those skills up for both our nursing staff and our medicine staff out there in the rural setting.
Well, that was my next question, is just the benefit, the learning and the teaching aspect of it, just what a benefit that is. I mean, all patients are treated the same, but geographically there are different challenges. I mean, talk to me about that a little bit.
Yeah, you're absolutely right. In some places there are large distances separating us from more advanced healthcare delivery. So how do we move those patients to and from? What skill sets do we need at the local level? As Dr. Weiss kind of mentioned, what's the workforce need to look like? And so what can we do as a center to kind of help identify that? And then working with our institutions, how do we help deliver the training for that workforce to be able to deliver the type of care that we need to improve the quality and the outcomes in rural Kansas?
Dr. Weiss, what type of services will be provided?
Well, we have a three spokes, I would say. Dr. Mosier speaks this well, in that we have education that is a focus area, research is a focus area, and service. And so there's all kinds of components within each of those areas. As Dr. Mosier just mentioned, we're working with the Kansas Hospital Association on a workforce, looking at workforce elements. And the education piece comes back to that sustainment. And then, of course, research. It might be, again, Dr. Mosier mentioned the transport of patients. That might be patient positioning, patient transport, equipment, the use of different types of equipment in the rural environment, just to name a few.
Did COVID slow down this project at all? Was COVID a challenge?
I don't believe so. Dr. Mosher might be able to speak to that better than myself. But
Dr. Mosher, yeah, I mean, we always ask people, how did COVID impact the work you were trying to do? And talk to us through that.
Well, Dr. Ojo put together the Rural Health Task Force to really look at what was the School of Medicine's role in addressing rural health care disparities in Kansas. And we started this right before COVID pandemic struck. With Friday morning 7 a.m. meetings to kind of learn what was going on across KUMC, the School of Medicine, and whatnot. And so we did that really over the 2 years of the COVID pandemic, virtual meetings with 30, 40 plus people attending these meetings. And so we were able to accomplish quite a bit and actually develop through a committee of like-minded individuals around developing the Center for Rural Health the business plan, and then submitting that back to Dr. Ojo for approval to move forward with the creation of our center.
Dr. Ojo?
Yes, so COVID provided us an opportunity to ask the question, what do providers in rural Kansas need to help them in their practice in providing care to patients during the COVID period? And when COVID is over, what can the center do to continue to support providers, all levels of provider in rural Kansas? One of the issues that affect provider is professional isolation when they are in rural communities. So one of the areas that the center will be focusing on is asking provider, what do you need and how can we help you to meet your needs? In addition to helping to increase the number of appropriately trained providers who will be practicing in rural Kansas.
So is this the type of center where you were getting feedback from patients, or was this something that medical providers saw as a need that needed to be fixed and helped and assisted? Just what can you tell us about that? Were patients speaking out to say, hey, we need better access and we need some assistance here?
I think it was pretty broad, not just patients, but communities, rural health stakeholders, economic development, you name it. Healthcare is a pretty important component to the economy in most of our rural communities. So being able to access healthcare and being able to have quality healthcare, should be no matter where your zip code may place you, but it's a challenge, and it's often limited numbers of professionally trained individuals, resources across from not just individuals but funding. And so those challenges we've heard about over a long period of time. Having been a rural provider myself, I certainly understand that, having been involved with the KU Health Systems Care Collaborative, been engaged with a number of rural communities. And then really in the long run, this started back when we had a physician workforce work group back in the early 2000s, kind of asking the question, how do we better identify some of the challenges in rural health and rural health status? What's the workforce look like? And maybe we could do that without creating a task force every 10 years to do that work. So the center will hopefully help accomplish that by addressing that at a multitude of levels, from the patients to the providers to the community to other rural stakeholders.
And speaking of our community, I do want to give our community a chance to ask some questions. So get those sent in to us. We'll get back in just a bit to those. But I do have one from Mary asking about telehealth. We know that really ramped up at the beginning of COVID, and it was something that was in the works, but people really took advantage of that. But how are folks adapting to that way of receiving their health care?
Yeah, I can speak to that, being part of the a telebehavioral health network that the Care Collaborative started with about 10 of our ACO partners. And that came about because of the partners identifying the challenge of getting patients in to mental health and behavioral health services. And it was a little bit to do with the continuity of care, as well as how do we integrate that in with primary care. And when COVID hit, they were coming into the rural clinic where they were used to coming for their regular medical care to get the behavioral health services. And we had to quickly kind of switch that into delivering those services at their home. And as the lockdown lessened and they were able to return back into the clinic setting, we still had about 20% of patients that really liked the convenience of being able to obtain those services in their home. And we know also during that COVID, the Care Collaborative and Jody Schmidt's great work on taking some of the funding for that to help move telemedicine resources into some of the rural communities. That's really taken off. Now, it's kind of challenging. Do you spend your time in seeing patients coming to the clinic, or do you spend time on the Zoom connection or telehealth connection? When you're limited in the number of providers in some of these rural settings, it probably doesn't matter how you deliver the care. But for the patient, if they have the broadband access and they can do the telehealth services from home, they certainly seem to appreciate that.
We've had some good feedback from that as well.
Yeah.
People adapting quickly. All right, we're going to get back to some more community questions here in just a few moments, but I want to turn now to Dr. Nathan Bahr, infectious disease physician here at the health system. He is back, well rested from paternity leave, in for Dr. Dana Hawkinson today with our numbers. How are you? Nice to see you.
Well rested. That's
Kind of, not so much.
that's optimistic view. Well, anyway, so I'm awake and here, happy to be here. We have 7 active patients today. That's a little up, I believe, from recent days. 2 of those patients are in the ICU. We also have 15 patients in that recovery period, so not with active infection, but still with needing hospitalization related to their COVID infection. So, certainly a lot better than it was. Somewhat stable where we've been recently, but still people sick in the hospital with COVID.
All right, thanks for sharing that. I do want to ask you, though, about this story that we talked about off the top of the show about the federal judge striking down the mask mandate on planes and public transit. You think that's too soon?
I sort of don't really understand why that's helpful. To me personally, a mask is no big deal. I wear one very frequently, and I just don't see the upside of that. When you talk about things like train cars, you talk about airplanes, especially when you're sitting on the runway, you're not or not on the runway, but you're loading the passengers, you're not yet having the air exchange systems on. Those are really just like containers of people breathing in and out in an enclosed area. That's so if yes, there's less COVID than there has been at different times, but there's just not an upside to making
right.
that
Well,
higher
you said
risk.
it's just not helpful, and I think
Yeah.
you make a good point. I don't think people aren't not traveling because of the mask. People have adapted to that, so let's just stick with that, for a
Yeah.
little bit longer if we can. Because on the flip side of that, Philadelphia reinstating its mask mandate
Right.
because they've noticed that the cases are rising. So you've
Right.
got people, on both ends of the spectrum. Your thoughts on that?
And Philadelphia is not alone in terms of cases rising, right? I mean, we are seeing that in a number of places throughout the country. Thankfully, most of these places we aren't seeing hospitalizations rise exponentially, anything like that. But it's sort of early in the rise in some of these places. We don't know exactly what we're going to see, and I would also say, just because hospitalizations aren't drastically rising, that isn't sort of a good reason to take away a layer of protection from people. Remember. We still have lots of people in our country that are immune suppressed that may not respond well to vaccination, and we all have a duty to protect them. We shouldn't just sort of say, well, you're on your own.
Yeah. Well said. Well said. Can't say that enough. All right, Doc, we'll get back with you here in just a bit. I know we've already got some community questions coming in for you today. So I want to get back with Dr. Ojo, Dr. Mosier, and Dr. Karen Weiss to talk about our conversation about rural health, the Kansas Center for Rural Health, exactly. Dr. Weiss, just where did the funding for this project come from? Walk us through that.
Multiple elements. We got an endowment from the Patton family, and then the University of the Medical School is funding a portion of it, as is the School of Nursing in our positions. But local funding.
So does someone need insurance to use the service? How do they access the services?
Well, the services that it's not, we're not providing medical care directly. We're building collaborative opportunities and building evidence-based practice across rural Kansas. So they'll still go to their providers, and it's just that we're going to be hopefully building some really great opportunities with those providers and help them with evidence-based practice and like we were talking about, the sustainment of education and training.
Dr. Ojo, so this is going way beyond Salina and Great Bend through the health system. How does this, with it encompassing the entire state, how does that benefit those in the metro?
It benefits those in the metro because one of the things that the center will be doing is to expand the opportunities for the management of chronic disease conditions. The Care Collaborative has created a template for providing chronic care or chronic disease management for more than 70 counties in the state. And so what the center will do is to provide opportunities for those who are in urban areas to understand the context of care and care delivery in rural parts of the state. We have to keep in mind that providing care for patients often require collaboration between those who are in the urban areas and those who are in the rural areas. They are often working together as a team to provide different levels of care to these patients. And it is important for those who are in urban communities to understand the context in which those patients are getting care when they go back to their communities, as well as how the care is being delivered in those rural communities.
Dr. Mosier, you mentioned the Care Collaborative. We've talked about it a couple of times here. Explain to people what that is first.
Sure, yeah. The Care Collaborative started as a CMS Innovation Award called the Kansas Heart and Stroke Collaborative, and it was basically to take the evidence-based guidelines on managing acute heart attacks and stroke and putting it into actual practice. And what we found was taking the educational component of that out from our subject matter experts here at KU, but also working with regional medical centers like HaysMed, that they had to be adapted to the local realities. We don't have a lot of ambulance services with paramedics on them able to go out into the field and get a 12-lead EKG. As a matter of fact, about 80% of our acute chest pain patients in rural settings come to the ER by private car. So we don't necessarily have the same level of activation of our pre-hospital care. But the Care Collaborative, in developing the educational model, helping with some care delivery model changes like Dr. Ojo mentioned, the chronic care management, and then also using our team to go out and help pull data so that we could look at where were there opportunities for performance improvement. We started with 13 counties in northwest Kansas with this project, and we were able to expand fairly quickly when CMS gave us the approval. By the end of that 3-year award, we had expanded up to about 50, and now we're in over 70 counties, 79 different entities that are part of this, and part of what we call our patient safety organization, which is registered through the Agency for Research and Quality, which allows us to pull data and protect that peer review information and work with performance improvement at the local level. We've not lost any of our counties that have joined us from the beginning, so I think that's evident that we are providing value. And that's the very same thing that we want to do through the center, is to make sure we're providing value back to our providers, those rural communities, so that they stay engaged with us. We have the opportunity to help them identify their need, how they're going to be addressed, and how we might be able to service that through either our educational programs or in partnering with others.
I'd like to ask all three of our guests just, how do you measure the progress? If we look ahead 5 years from now, Dr. Mosier, I'll start with you. What would you like to see? What would show you that we're moving in the right direction, the way it was planned?
Yeah, it's a great question, and we obviously, in developing a business plan, have set up a lot of key indicators that would give us some measure. But, for us on the campus in Salina, we have medical students and nursing students. So, simply we'd love to see, an increasing number of our students who are engaged in some of the early community work with many of our rural communities, not only just around the Salina area, but out across the state. The number of projects, obviously, as a research institution, we look at, might be total dollars. But some of that I think we want to look at also what's the impact. Are we making any change in the needle of our declining healthcare status and health outcome status that Kansas has slowly been falling down? And we need to determine what's our role and what can we do to start making some improvement in those numbers.
Dr. Ojo, what would you like to see?
Yes, in 5 years, we hope that we will have developed a specific rural track training for undergraduate medical education. We also hope that we will have developed rural track training for different graduate medical education programs. in primary care as well as in specialty areas. We also hope that in 5 years we will have launched several pragmatic projects that are looking at research questions, especially in the area of healthcare delivery science and how care can be better delivered to rural communities. I also believe that in 5 years we will have a more comprehensive understanding of both the short and long horizon needs in terms of healthcare providers in rural Kansas.
Dr. Weiss, same question to you. 5 years from now, the Kansas Center of Rural Health, hopefully we'll have a new standard of care, if you will. What would you hope to see?
In 5 years, I would hope to see that we've built a strong foundation with the center so that state, federal, our rural stakeholders know that we're a location that they can reach out to bring capability together. And as Dr. Ojo mentioned too, I would expect us to have some really robust research projects going that students can become involved in, and the local communities can become involved in. And the other thing that's really, really probably the most important and the most exciting, and Dr. Mosher mentioned this, is that hopefully we will see the improvement in the outcomes in our rural community and the healthcare systems, and an excitement for the work that we're going to be doing together.
We're going to get to some community questions right now because we've got a few great ones coming in for our guests today. Question about telehealth. Isaac wants to know, has the recent rise in telehealth helped address the rural healthcare deficit? I understand the potential, but I do know that rural areas lag behind in terms of internet connectivity as well. Dr. Mosher, you had mentioned that.
Yes, that's true. We did find during the time we were rapidly expanding some of the platforms for using telemedicine services in these rural communities that in some places there just wasn't good enough broadband for the application of that. So that is a limitation. There's a lot of challenges too. Telemedicine allows the delivery of services within a community, and if that's not the local healthcare delivery system, then they're losing out some of the revenue that would support and keep them there local. So, there's good and bad, but it certainly allows for the accessibility of more advanced services that just aren't going to be available in that rural setting. That would cost a lot of out-of-pocket expense for the patient, but also time for travel out to wherever that specialized service may be. So I still think it's critically important to look at the role that telemedicine has in delivering healthcare service in the rural setting. But there is no cookie-cutter approach to that, and that's often repeated in rural healthcare. I think each area has to look at how that's going to be utilized.
On the same topic, Catherine is asking, and anyone can jump in on this, at the beginning when we were talking about telehealth, there was a concern about legislative issues. Is that still an issue? Seems like a long time ago, but have we gotten past that?
There are always some legislative challenges, but I think that's still, kind of what we want to know is where do things stand once the public health emergency declaration ends. The biggest challenge for rural health was you had to have the services delivered in a particular location. You certainly couldn't give it to the patient in their own home and be qualified to bill for that service. So it needs to be viewed from the rural lens, I believe, and unfortunately a lot of times that's not always the case. So at this point I would say we still have a lot of work to do to find out how this is going to look when we're through the COVID public health emergency.
Dr. Ojo, Joellen wants to know, do they have a definition of rural based on population, doctors, hospitals, etc.?
Yes, different federal agencies and sometimes state agencies have different definitions for what is considered rural. And in fact, I think there are at least 25 different federal definitions of rural.
I won't make you give those, I promise.
But most of it are based on population and distances from urban areas.
Anything else to add on that?
No, that's probably the simplest one is, if it's not urban, According to the Census Bureau, it's rural.
It's rural, population-based.
Yeah, population-based, and as Dr. Ojo said, distance and where the economic flow of services focus. So it is challenging, and it really does depend in the context of how you're defining it, oftentimes by the program you're involved in.
All right, anyone jump in on this one too? Ruth Ellen has a good question. How has legislation at the state or national level, has it helped or hurt rural health care? Dr. Weiss, any insight into that?
Well, I was going to even go back to that. There has been legislation even for the telehealth piece. And we're increasing telehealth capability because of it. I was trying to think of some other legislation recently that's impacted rural health, and I'm drawing a bit of a blank.
You know, one thing that's been an issue with telehealth is that, you know, we've been talking a lot about rural Kansas here, but of course, at the health system, we provided health care to folks from other states as well. And so one thing with telehealth is that, you know, we do have to have licenses generally whatever state your patient is in. So if your patient is sitting at their home, you know, literally across State Line Road from our health system, we do have to have that Missouri license too. So that's another sort of impact of this that is a little, you know, that's been new to us. And we had a lot of docs and providers that were really rapidly trying to get their licenses from Missouri too, so they could do that. And I know we have folks that are providing care to people that live, you know, further in Iowa and Arkansas and things like that as well. So that's a really important thing. And, you know, I would just say in terms of legislation, we generally, I think the less prescriptive the legislation is in terms of what care we can and cannot provide, that's a good thing. And so when we start talking about legislation and potential legislation, that's always a worry to us when we talk about providing health care, sort of being told what we can do outside of what medicine sort of guards on its own.
Thank you for adding that. I'm going to ask you to put your COVID hat back on, though. Put it on. It's on? Okay, got it. Got it on tight. Brandon wants to know, is it really safe for me to leave isolation after 5 days? He says he feels fine, but he doesn't want to put anyone at risk.
Yeah, I mean, I think that's sort of a little bit of a gray area. You know, I think if you're feeling good, likely it's okay. But if you're concerned about putting people at risk, particularly say, you know, you're talking about, well, you know, if I go back to work, there's, you know, somebody I know at work that, you know, is immune compromised or I know they're unvaccinated or whatever the case may be. You know, waiting a little longer makes sense. The problem is, you know, this isn't, again, going back to what we've been saying, there's not cookie cutters for most of this stuff, right? So, you know, while 5 days might be very reasonable for many people that feel good, there are going to be folks that are still shedding virus and can still infect folks. So if you want to be safe, I'm all for it.
All right. Well, Terry has a question for you. She says, is it now a bad idea to fly to visit my unvaccinated grandbabies? She, however, is fully vaccinated.
Yeah, it's a hard question, isn't it? I mean, yeah, I'm thinking of that question myself because we recently planned a trip we're going to fly for, and my wife, some of you probably remember I mentioned she's an ICU doc, and we're sitting at home last night going, ugh, what are we going to do here? And I don't know that there's a right answer there. You know, I think being vaccinated, of course, is a big thing you can do for yourself. Wearing a N95 on the plane, you want to give yourself the best protection you possibly can, because, you know, we know that those masks, those high quality N95 masks are going to protect you better than a cloth mask or something like that. So those are the things you can do, but ultimately it's going to be sort of what is your risk tolerance, right? Are you going to be sort of okay with flying on a plane knowing that there's going to be a lot of unmasked people, and some of them might very well, be carrying COVID.
All right, we're going to get to our final thoughts. Any reporter questions on the line? We good? All right. Dr. Ojo, I'm going to start with you because you may need to scooch out of here real quick. What are your final thoughts? What would you like us to know?
What I would like us to know and to keep in mind is that the Cancer Center for Rural Health is going to be working very closely with multitude of organizations across the state that are responsible for providing health to the people of rural Kansas.
Dr. Mosher, your final thoughts today.
Yeah, I would agree. We're just getting started with the activities of our Center for Rural Health, and I've had an opportunity to visit with a few groups, but there are many more groups and individuals that I want to get in front of to talk about the concept and what we hope to accomplish with this and how they can engage with us in some of the work. We did successfully begin our inaugural Rural Health Council here at KUMC last month. As a matter of fact, we have a second meeting this afternoon, and it's really exciting to see all of the different disciplines and folks across KUMC that are engaging in the conversations about rural health, and I appreciate that. So look forward to greater things coming forward, I believe.
Dr. Weiss?
I wanted to add that in a very short amount of time, in less than 3 months, we've worked with some local hospitals, and we've put together a project in which we're working with respiratory therapy and nursing, because of course we're going to be dealing with long COVID issues, and we want to make sure that in the rural communities that folks are trained and prepared to deal with that. And we put in a project that is dealing with maternal strategies for in rural communities. And lastly, I wanted to add that in terms of the telemedicine piece, we're working on policies and procedures across rural communities to address those issues across state lines for each hospital and the elements that they have to deal with. So we have been really busy already. I mean, working on some neat projects for rural communities.
Well, being busy is very good. That is good news. And we appreciate all the work you're doing. Thank you so much. Dr. Mosher, thank you as well for all the work you're doing. Dr. Bahr, your final thoughts today. Be nice. I know you got a lot on your mind today about these mask mandates.
I'm sleepy,
lifting,
I'm cranky.
And you're tired and you're cranky. By the way, speaking of numbers, you got 3 now, 3 babies.
Yeah,
How old's the youngest one that just came?
So the youngest is about 7 weeks now.
Okay.
We have a 2.5-year-old and we have an almost 5-year-old.
All right.
So
wow. That's 0 sleep.
We're with it, yeah.
Okay. Well, I'll let you get out of here, but give us some final thoughts first.
Well, it's exciting to hear, about the developments with the Center for Rural Health. I think when you practice in an urban area like Kansas City, sure, lots of our patients come from right around here, but lots of our patients come from around the state as well. And so, there's so many things we can do to improve linkages of care from our area and throughout the state and throughout rural areas in nearby states as well. So this is really exciting. And I think, what I'm excited about is it'll help us with things like, managing complex cases where patients need multiple specialists and need really close monitoring locally. They can't just drive to Kansas City 5 hours away. That's not how life works.
Well,
so this will help a lot.
Interesting to see how the trickle-down effect works from the projects they're working on to how it affects you and the way that you treat your patients. So, all right, thank you for being with us today. We'll see you soon. In headlines this morning, they may be magically delicious, and I do agree they are, but Lucky Charms cereal is now under investigation by the FDA. According to the website iwaspoisoned.com, more than 3,000 complaints about the cereal have come in since last December. More than 100 of those complaints were filed just over the weekend. Many folks are complaining of nausea, diarrhea, vomiting after eating Lucky Charms. The maker of the cereal, though, that's General Mills, they say in its own investigation has not found anything wrong with their cereal. While helping your neighbors, family members, and strangers in need, while also helping those in Ukraine. The Community Blood Center's donating money to Ukrainian refugees for anyone who donates blood. So Chelsea Smith from the Community Blood Center is joining us this morning to talk more about this drive and how supplies are doing here in the Metro. Chelsea, good morning to you.
Good morning. Thanks for having me.
Always good to see you. So first, tell us a little bit about this partnership and how people who are helping those here locally are also now helping those who are suffering in Ukraine.
Yeah, so a few weeks ago in March, we were contacted by Global Blood Fund. They're an organization aiming to increase equity and access to blood products across the globe. And they actually contacted us along with blood centers all across the country regarding a rehoming program for Ukrainian refugees and asked us to partner with them in terms of donating funds for this program called Rehome Ukraine, which pairs Ukrainian refugees with host homes across the UK, Canada, and the United States. So obviously that was a no-brainer to us. We said, absolutely, we'd love to join this initiative. And for the month of April, we are donating $1 to Global Blood Fund and the rehoming program for the Ukraine for every single donor who comes in and registers to donate in April, but also registers online and says, yes, please donate on my behalf.
And you can use that QR code there on your screen to find out more information and get signed up to donate blood. But Chelsea, I would imagine with the blood shortage that you've been talking about with us over the last 2 years, and now with what folks are seeing in Ukraine, they are moved to help those folks. I can't think of a better way for people to help people all over the globe and here locally.
Yeah, absolutely. I mean, we've been, like you mentioned, struggling with our blood supply for 2 years now. We're still not where we need to be. We need a 7-day supply to feel comfortable. 7 to 10 day supply is our sweet spot, and we've not seen that since March of 2020. So it's been a long road for us here locally, but we also know it's been a long road for people all across the globe. And now with the news coming out of Ukraine that we're seeing every day, like I mentioned, this partnership really was a no-brainer. It's an easy way for donors to be able to double their impact. You're both helping patients here locally, but also helping Ukrainian refugees who are in need of shelter and accommodation. So we're really hoping that we're going to see an outpouring of support this month. We've already seen an outpouring of support this month, but we're hoping it's going to carry us into May and some pretty challenging summer months as well, that we'll be able to help Ukrainian refugees and patients here locally.
Fantastic, Chelsea. I think people are really eager to help out. Just lastly, have you seen at all a bounce back? I know you've been struggling through COVID. Are you seeing people returning? Are people holding those blood drives like you were hoping they would? Where's the challenges still lie?
Yeah, we are seeing more blood drives being added back to our calendar, which is a huge help. One thing that we're missing still is youth donations. So high schools and colleges basically had to stop hosting blood drives altogether in 2020 and a little bit in 2021. We've seen them come back, we've seen them return, but we haven't seen the donations from those locations rise to what they used to be. So we're still seeing lots and lots of donors that haven't returned since pre-pandemic, but also we're missing out on a lot of first-time donors in the form of youth donations. So it's challenging. COVID is still impacting our blood supply, the way that our business operates, unfortunately, and we're hoping that this year is going to be more of a return to normal for us than the past two.
Yeah, we certainly hope so. There's that QR code on your screen if you want to help and donate. And Chelsea, thank you so much for all you do. As you know, friend, you're always welcome to come back. We're always willing to help you get the word out.
Thank you. Thank you so much for having me.
Thanks. Have a great rest of your week. All right, a live look now at downtown Kansas City, where a big tradition gets underway here pretty soon. If you didn't know it, it's Fountain Day in the City of Fountains. So at 10 a.m., all city-owned fountains are going to be turned on. This year's ceremony will pay tribute to Anita Gorman. She was the first woman appointed to the city's Parks and Rec Board back in 1979, and she founded the group to help maintain the fountains in our beautiful city. Mother's Day, just about a month away, and we want to hear some of those ideas. Get them sent in to us. What do you like to get? What do you like to give? Use that QR code and send us an email at medicalnewsnetwork@kumc.edu. We'd like to share those here and get some good ideas rolling in for Mother's Day. And thank you so much for being with us today. As always, don't forget you can watch our shows anytime by logging onto Facebook, Twitter, and YouTube. Have a great Tuesday. The BA.2 variant is here, but does anyone care? Blood clots 6 months after COVID, access to COVID drugs. Join us for open mics as we rip from the headlines and tell you what you need to know. See you at 8 on these social media channels.
Subscribe to our morning medical update and open mics with Dr. Stites podcasts. Now everywhere podcasts are available.